Hi, I'm Katrina from Ergo Fit Life, and I'm here to talk to you about ergonomics in operator positioning for the dental clinician. The first thing that we need to talk about when it comes to operator positioning is neutral posture and what neutral posture looks like as opposed to what it doesn't look like. So what we need to know is that neutral posture means that our ears are above our shoulders, which are above our hips, our knees, and our ankles. We want our body to be perfectly aligned and straight. If we're practicing where our head is lunged forward, that is not neutral posture. If we are practicing while leaning forward, that is also not neutral posture, and we feel it at the end of the day. So we need to learn how to get into neutral posture in order to maintain it. The first thing you can try is simply taking a breath. Anytime you get into a patient's mouth, before you put your hands in there, simply take a breath. You'll notice that my shoulders involuntarily go back and down when I exhale. Try it on your own. That's a good exercise to do when you're sitting there. You don't have to make as pronounced of a breath as I did, but for this purpose, we're going to do that. Now, when you put yourself into neutral posture and you engage your core, you're going to be in something called active posture. So whether you're in active sitting, you're in active standing, because the reality is we have basically two ways of treating patients. Either we can stand or we can sit. You want to make sure that your spine, which is supported by your core, is being done so as opposed to relaxed and passive sitting, or like we like to do in our lazy boys at home, where we are leaning back in a chair. If you have a lumbar support in your chair and you're talking back with your patient about OHI and you're having a casual conversation, this is passive sitting. This is comfortable where our core is not engaged. It's a very easy way to sit down, but this is not the way that we need to be doing dentistry. So we have always been taught in school about the 90-90-90 plan. The 90-90-90 plan is where we are sitting with our elbows at our sides at 90 degrees with our wrists in neutral posture. We got that down. We know we need to stay there. We've also been taught that our thighs need to be 90 degrees from our spine and parallel to the ground, and that we need to then be at 90 degrees from our knees to our shins and on the ground flat. So that's where we've learned something. We've learned that this 90-degree positioning here is really what's hurting us. And what we've done on our own to try and fix that is we perch. Let me demonstrate. We sit on the edge of our chair so that we can get less of that 90 degrees. Now, why is that? The reason that we do that is because we're trying to make sure that this psoas muscle, which originates in our lumbar spine on every one of those vertebrae, and inserts together into the top of our thigh. That muscle, when we sit at 90 degrees, it gets shortened, it gets tight, it pulls on our lumbar spine. And let's face it, most of us are already leaning forward as it is. We're tacoing ourselves into this position all day long and hunching on top of it. So what we've done is we sit here and perch on the edge of our seat, trying to give our legs a little bit more distance from our spine. Well, that can help, but it's not going to give you enough to really get you through the end of the day if you're also leaning forward, putting it right back into that 90 degrees. What can we do? If you're sitting on a traditional stool, one thing that you can do is raise it up as high as you can get it. So that looks like this. Now you'll see that you're going to sit at much closer to 135-degree angle, and your psoas muscle is not going to be getting nearly as shortened and tightened as it was before. That can help. The only major drawback to this is that your propensity to lean is still going to be there because these stools aren't designed to hold you back. And the other issue is that you're going to lose blood flow to the back of your thighs. It kind of cuts off circulation. So that's a little bit of an issue as well. It's a nice attempt. It's the only option you have. It's not a terrible option, but there's better. And that's what we want to do. When we know how to do something better, we should do it better. let's look at what that looks like. This is where a saddle stool comes into play. Your saddle stool will actually hold you in. Your saddle stool won't let you fall off the front of your chair if you're sitting in it properly. You'll notice your legs are still at about 135 degrees, your psoas muscles not being shortened. You've also got a tapered side here so that you're not getting circulation cut off to the back of your thighs. That's really, really important. A lot of the times we end up with sciatic issues and things like that, and that can result in our legs being up. Another thing that is a little bit more difficult to do in a saddle stool, and it's the one thing that I am the most guilty of in a traditional stool, is putting my foot up on a wheel. It's a lot more difficult to do that because in a saddle, you want to be even. Your body automatically wants to sit even on a saddle stool because it's not flat. And so you're less likely to lean and you're less likely to have one foot up. So it helps you to stay in good ergonomic practices as well. And by practices, I mean keeping your feet flat on the ground, both of them at the same time so that your hips are even and not uneven. As soon as one hip goes up, what happens? The spine follows. So we want to avoid that. Keeping your feet flat, keeping yourself at 135 degrees rather than 90 degrees. And then your spine is engaged. Without the lumbar spine or lumbar support there, you're not going into passive sitting. You're going into active sitting. Now, there are certain stools that have a lumbar support that engages with your core. That's a great tool, and that can be used for active sitting, and it actually engages your core more, which is even better. So when you're sitting in one of these stools, you're going to be in neutral posture. It's going to feel a lot better. And then you take that deep breath and you'll feel a lack of tension on your lower back, a lack of tension in your shoulders. Another thing we need to make sure of is that our feet are, our stools are able to roll across the floor evenly and with ease. So we don't want carpet in the operatories. We want something smooth, and we want to be able to get access to 12 o'clock. That's pretty essential to what we need to do in order to get into our most beneficial ergonomic position, which is 12 o'clock. Now, not every operatory was made in the same way, but there are things that we can do if, for example, we have rear delivery or we have a cabinet behind us that is not movable. We can take the patient chair and we can swivel it so that it moves, and we can use the corner of the room to get to 12 o'clock as opposed to trying to navigate in between a tiny space. The other option that we can do is move the chair forward. When I say forward, I mean away from 12 o'clock. We want the patient chair as far forward as we can get it. If that means moving it 6 inches, because that's the only space that you have between the electrical input and the chair, 6 inches is enough to get you in there a little bit better, that may work for you. So give that a shot. Another thing that we can do is stand. The benefits to standing are massive. So as operators, we want to think about what we can do to get away from static positioning in the body. The body's not meant to be a stone statue all day long, be it in a chair or standing in any other way. So if we can avoid static positioning, we're going to put our body in a better chance to recuperate from the laborious task of practicing dentistry. So the benefit here, and what I mean by avoiding static positioning, is micro shifting. When you micro shift, you're moving your weight from one foot to the other. You're leaning forward on your toes a little bit. You're leaning back onto your heels a little bit. You're going to much more easily be able to access your tools or move to 12 o'clock really quick or get into these other positions without having to lean. That which is done easy is done more frequently. And so therefore, if you can easily get into proper ergonomic position with regards to where the patient is at, you're going to do it more easily. So when you have your patient back, and I'm going to move this pretend patient in this chair back. want to make sure that that patient position is such that your hands remain at this 90 degrees where their mouth would be. That's going to be too low for me. So I need this patient to be right about here so that when my arms are at 90 degrees, I can easily get into their mouth. If I need to work on a surface that is on my side of the chair, as a lefty, we're going to say the buckles, for example, of 19, 20, 21. I'm going to have the patient turn away from me a little bit. So that way I can retract with my arms down. So you'll notice I don't have to do the chicken wing. I can retract and look very easily. And I don't have to put my head all the way down like that. We want to really avoid lunging our head forward and down as much as possible. At the same time, I can also access the linguals of the right side on the lowers or the right side of the uppers. Adversely, if I want to work on the other side, I bring that patient head toward me. So we're doing a lot of patient head movement so that you can adapt their mouth to your view. Because at the end of the day, you're here for 8 hours. They're typically here for about an hour to an hour and a half. They can move towards you a little bit. It takes some coaxing, it takes some positive praising, but at the end of the day, it really comes down to training your patients for what you need from them. Getting them just to lie in supine position requires some training. They need to know what you need from them. So when we say turn toward me and the patient literally moves their eyes and that's it, what they need to know is that you mean move toward me, move your mouth toward me. And you can give them some guidance with fingers or use, positive and excited information like, oh, keep coming. And it'll help them to know what you expect of them. So that is another thing. Another good practice to have is the first thing that I do when I walk into a patient's mouth is I say, put your chin way up, and I demonstrate for them what I'm looking for. I'm doing two things when I do that. The first thing I'm doing is I'm showing them and training them on what I want them to do. And the other thing is I'm giving my neck a stretch. So you can benefit and they can benefit, and then you can benefit again by being able to actually see what you're trying to do and where you're trying to get in the mouth. Now, not every patient is going to be able to lie back all the way. Not every patient is going to be able to put their necks back. What will help greatly is having a neck pillow that is adaptable to them. I prefer the microbead pillows because they are extremely adaptable to their neck and their specific head and the amount of space that you have, as opposed to a pillow that makes their head put their chin down on their chest. That doesn't help you and it doesn't help them. It makes the whole thing much harder. So a pillow that is very pliable and movable is fantastic. It will help you with your positioning because then you can easily get them to move back. If you have a patient that is in a wheelchair, for example, or has skeletal changes so that they literally cannot move, you're going to exercise a lot of indirective vision. Live it, practice it, breathe it, eat it. It is your friend. The more you do indirective vision, the easier your operator positioning is going to be. The next thing we need to talk about is how you move this patient from that sitting up position into the lying position. What I like to call it is autopilot. If you tell that patient, okay, we're bringing you all the way back to where I need you to be, and then if you need to move up from there, we'll do that for you, no problem, Mrs. Smith. Sometimes, most of the time, they'll say, oh, I can't lean back very far. Oh, that's okay, we're on autopilot. Our chairs are on autopilot, or a doctor just upgraded our chairs and they have autopilot in them. So I'll bring you up from the bottom, no problem. And you're encouraging them to trust you, and then you give them the option of coming up from the bottom, adjusting a little bit at a time, as opposed to bringing them back a little bit at a time from the top. You'll find that you get them back further, you get to get into position better, and then everyone is happy. So to cap it all up, you want to make sure that A, you're alternating sitting and standing if possible. If you're going to stand full time, make sure you've got good cushiony footwear and some compression socks, because Otherwise, you end up with spider veins and issues in your feet. But if you're going to alternate standing and sitting, that's a really fabulous way to incorporate micro shifting and also giving your feet a chance to relax, because at the end of the day, when you've had 100% of the gravitational pull on your spine, your hips, your knees, your ankles, and your feet, it'll feel a lot better than if you're sitting all day long and all that pressure is on your spine and your hips. So giving some variety to your positioning is great for your body, great for your longevity in your career. Grab your saddle stools if you don't have one. Make sure you get fitted for one, just like we would your loops. I sat in a chair or in an operatory once where there were 35 different chairs for me to try out, and 2 out of 35 chairs fit me. So it's not a one size fits all. You want to make sure that you have the option of a seat pan tilt for your saddle stool. It's extremely important because not everyone's pelvis sits the same. And if you are stuck in an operatory where you do not have the option of getting a saddle stool, and you don't have the option of standing full time, get that chair as high up as you can. Make sure that you're moving the patient towards you, and get an assessment. So I hope that this is valuable to you and that you have enough information to get you through the day, and that you can leave work at the end of the day feeling less fatigued, and that you will have a great pain-free career in dentistry.